Hey everybody, Mark Ellert here with some story time. Today's story time is fuck the healthcare system. There is no healthcare system. It's disease management. Doctors want to help manage your diseases so you keep coming back and buying their services and you're a reoccurring customer. If they helped you do preventative measures, if they preserved your health and did health care and made you stay happy and healthy, they wouldn't have a job. They wouldn't have a career. They want you to come back and they want to sell you their services. For the last 3.5 years, 41 months, I've been harassing my healthcare team just to try to help me with my problems. All they've done is do me a giant disservice and pretty much destroy my life. This all started in March of 2018. I had constant chronic pain that was interfering a lot with my daily lifestyle and activities. I started seeing my healthcare team about it. For 2.5 years, my healthcare team did nothing. They put me through the ringer and just give me the roundabout. Literally 2.5 fucking years. Constantly, my primary would either refuse to give me the referral I was asking for, so I'd have to drop my primary and change doctors. Or I would see the specialist and they would refuse to help me because they said it was out of their specialty. Most of my doctors didn't take me seriously either. For those of you that don't know, I have mental illness. I have a history of suicide. September 12th, 2004, age 19, I attempted suicide by putting a gun to my head. I have total blindness ever since. It took me a lot to rebuild my life. So pretty much all the doctors that I'm seeing, they're not taking me seriously because of my mental illness. They're blaming it on my post-traumatic stress and my anxiety. Most of the doctors are also saying they won't and can't help me because it's all nerve damage from my brain injury. It's all pre-existing. So pretty much, I've already had to rebuild my life after an attempted suicide and losing my vision. I already carry a lot of guilt and a lot of regret. Now pretty much for 2.5 years, my whole healthcare team is refusing to help me, and they're pinning it all on something that's already traumatized me, and they'll refuse to help me. Now they're pretty much telling me this is gonna be a lifelong chronic pain condition and they can't help me. It also doesn't help that they refuse to give me anything for pain management because of my history of suicide. If they give me pain management and I actually overdose or suicide on it, then they're held liable. So none of my doctors refuse to do anything for pain management. None of my doctors want to be able to help me. They're pretty much just constantly saying it's out of their specialty and they drop me as a patient. I'm dealing with this for 2.5 years. 2.5 years, I'm losing function of my hands. I'm constantly have tremors and I'm shaking and dropping things. And I have this chronic pain in the back of my head. There's just building pressure I'm just nauseous all day, every day. I feel like I'm gonna faint and lose consciousness. At night, I'm constantly being awoken, having convulsions and seizures. That's never happened before. So I'm losing a lot of sleep and I'm losing a lot of quality of life. After 2.5 years of dealing with this, I become very suicidal. It was detrimental to my mental health. I was losing quality of life. I checked myself into the ER about 3 different times being suicidal. Finally had an ER doctor who had some compassion, hooked me up with a pain management doctor. My pain management doctor helped me for the next couple months get through things till we can find a diagnosis and figure what's going on. Pain management helped me a little bit get through my day and have some function. My pain management doctor, he referred me to a neurosurgeon who had a very confident diagnosis of occipital neuralgia. He thought my occipital nerves in the back of my head were inflamed and giving me so much chronic pain radiating through my body. Because nerve pain is funny like that, it can do different things. So they were convinced it was nerve pain and they wanted me to do a nerve ablation. Nerve ablation is where they literally sever and completely obliterate the nerve to stop the chronic pain. I'm dealing with this for so long, I'll do anything at this point. It's a last resort and I will do anything for some peace of mind and happiness. So I go through with this procedure. February of 2021, I had my right occipital nerve obliterated. And then it took about 2 or 3 weeks of recovery time. It wasn't a very, very pleasant experience. Having a nerve obliterated isn't fun. It took 2 or 3 weeks of recovery. Then in March of 2021, I had my left occipital nerve obliterated. Another 2 to 3 weeks of recovery. I started doing physical therapy. While I'm doing recovery and physical therapy, I'm starting to notice a lot of relief. A lot of my symptoms are starting to dissipate. A lot of my pain is going away, starting to have function and manage things. So my healthcare team starts weaning me off of my pain management. Here we are 6 months later. I'm off of my pain management. I'm still doing physical therapy. All of my symptoms are coming back. They're all coming back hard and I'm having the same issues. Just last Thursday, I had an assessment with my physical therapist. My physical therapist pretty much told me there's a lot of tightness in my neck and shoulders. He can tell I'm losing a lot of my range of motion that he said it looks like my occipital nerves have grown back. I'm like, pardon me? I literally, just on Thursday, 6 days ago, 6 months post-surgery, I found out that when you have a nerve ablation, it's not permanent, it's only temporary. They obliterate the nerve, and on average, 2 to 3 years later, the nerve will grow back. When the nerve grows back, you actually have scar tissue, and it's gonna give you more pain. The point of this was to help me relieve my pain. And I'm literally just now, 6 months later, I'm still in the middle of physical therapy from the procedure. I literally 6 months ago had both of my nerves obliterated, took recovery time, and I'm still in physical therapy from it, and I'm just now finding out that it's actually not permanent, temporary. Most people would take 2 to 3 years, and when it grows back, you're in that much more pain, they recommend a nerve ablation every 2 to 3 years for life. For life, they want me to be doing this procedure now, and I'm one of those freak occurrences where it happens every 6 months. So they're pretty much telling me this now. 6 months post-surgery, this is going to be a reoccurring thing for life. The point of it was to help me. It was preventative measures to help. I could have just stayed on my pain management this whole time and managed it. But now they want me to stay on pain management. They want me to keep doing my nerve ablations, and they want me to keep doing physical therapy. They're just trying to add more and more to my mix and give me a bigger bill. Literally, fuck that. I'm not giving them any more of my money. I'm not coming back for nerve ablations just to have it redone 6 months later while I'm still doing physical therapy. It's not going to be permanent. It's not going to help my pain. It's going to make my pain worse. So now at this point, I'm just going to stay on my pain management and work through it. It's also worse that they did me even a bigger disservice. Because the reason I'm making this video, last night, September 7th, Tuesday, I'm literally trying to get ready for bed. I'm drinking a glass of water and taking my nighttime medications, and I can't hold that glass of water. I dropped it and it shattered on my kitchen floor. So here I am, a blind man who lives by himself, who now has to clean up this mess of water and shattered glass all over my kitchen floor when I'm just trying to get ready for bed. When I'm already so much in excruciating pain that I can't even hold on to the fucking cup. The last thing I want right now is to be cleaning this mess up. It was detrimental to my mental health. It made me feel worthless and pathetic. They did me a giant disservice because this entire time, I'm literally now just finding out the whole time I had that chronic pain in my hands and wrists, they wanted me to think that it was nerve pain radiating through my body, but they missed something. It's a dual diagnosis. I'm a musician. I'm an active person. I've been playing music for over 20 years, so I have soft tissue damage in my hands, my forearms, and my wrists. Playing for so long, I did damage. But that was the point of this, was preventative healthcare. I'm a career musician. I want to play music and do the things that I love for the rest of my life. I'm fucking blind. I need my hands. I want to have hand function and be able to live and do the things that I love. I want to live. I want to have quality of life. The point of me seeing these doctors was to prevent the soft tissue damage in my hands. I want to have my hand function. This whole 3 years that they've been bringing me through the ringer, put me on my pain management, it masked all of my chronic pain in my hands. It made me think it was something else going on. I had surgery and physical therapy and all this for no reason. It's something else this whole time. And for these 3 years now, all it's done is perpetuate my soft tissue damage. I have even more soft tissue damage in my hands and I have less function now. That's why I'm making this video. I don't want anyone else to have to deal with the disservice that I dealt with for this entire time. Last night, dropping that cup, it destroyed me. And now over these 3 years, I have even more soft tissue damage. I have less function of my hands and it's absolutely killing me. I want anyone else who's had any of these problems before, I want you to comment your experiences down below. We need to make some reform. I want to share this video and reach as many people. I want your voice to be heard. You're not the only one that the medical system did a disservice to. I want you to be heard. You're not alone. Everyone, we can make a difference. We can do some change. We can do some reform. This whole time, they were ignoring something. My chronic symptoms have perpetuated and gotten worse. Now I'm adding more to the mix. I have to start seeing an orthopedic and doing physical therapy, but I'm doing it for myself. I'm doing a service for myself. Everyone, remind yourself when you're going to your doctor to advocate. You know yourself the best. You know that you're there for them to do you a service and help you manage and maintain your health. Don't let them intimidate you. They have a 7-year degree. Don't let them put ideas in your head and intimidate you or scare you. When they have a treatment plan, ask questions. Be assertive and advocate for yourself. Ask questions and know what you're getting into. Make sure this treatment plan is going to address your problems and not pretty much just put you through the ringer and make you come back for more services that they're trying to sell you. Make sure the treatment plan is going to help your condition and it's what you're looking for. Remind your doctor they're there to do you a service and manage your health. You don't want them to manage your diseases and make you coming back, everybody. And everybody, thank you for tuning in today. I'm Mark Ellert. There's going to be more coming at you really soon. But until next time, keep it sexy, make good choices, and bam! I will catch you on the flip side.